Hi, friends. There are days I am happy, there are days I'm sad. There are days I have remarkable belief in myself, and there are days I doubt myself. There are days I want to be everywhere, and there are days I just want to be to myself. This is subject to the total wellness and well being of my mind or the state of my mind. This is the reality of myself and many of you out there. Just imagine the situation with kids. So, mental health is basically about the total wellness and well being of the state of your mind in the way you think, the way you behave, the way you feel, and the way you connect with people. And the opposite is mental disorder or mental illness. So when children have problem in the way they think, or they have delay in thinking, in responding, or in reacting, or even in forming relationship among other things, that could be a concern. However, when you hear about mental illness, it is not something that you have to be scared about. You just have to sometimes observe, because yes, children have their days off, and it might be because you're not paying attention. So the way they behave at home and the way they behave at school could determine their mental state of mind, whether they are behaving appropriately, they are feeling appropriately, they are talking appropriately, or they need some level of help. However, when you see the following in your children, it could depict that there is a challenge in the way they think or the way they feel. Number one is anxiety disorder. When children are overtaken by extreme fear or they are overtaken by grief, you need to be watchful. Another one is attention deficit hyperactivity disorder. When children can never pay attention, they cannot self-regulate themselves. That's it, and they lack social self-regulation. That's another concern. The next one is autism spectrum disorder. You see, autism spectrum is something different on its own. However, mental disorder is inherent in autism spectrum because the way the children behave has to do with the connection of the way their brain functions. Do you understand? So sometimes mental illness is present in some situations. So just get that clear. The next one is basically eating disorder. When children are scared of eating because of the way they think they are going to look in terms of their weight. Yeah, and then you have depression and mood disorder. When children are always sad and they always have mood problem or mood swings, it could also be a sign of mental illness. Post-traumatic stress disorder. When children can never forget traumatic experience that has happened over time, it could be death of their parents, incarceration, domestic violence, sexual abuse, and more. If all of those things continue to haunt them or hurt them and they cannot overcome that, that's another thing. And the next one is oppositional deviant behavior. When children choose to intentionally not listen to you, that's another concern. And then conduct disorder. When children cannot coordinate themselves and they have extreme anger issue. What are some of the things that you should observe that will potentially show that your child has mental illness? Number one is when a child is always sad. Another one is self-harm, when they harm themselves. Suicidal thought, when they want to kill themselves, they just feel that this life is not for them. Trouble sleeping, when they have also constant headache and stomach pain, and then they always have mood swings or mood problems. Diagnosis. How can you watch out? Number one, have a medical examination if you think that your child could potentially have a problem. See a medical practitioner. Also observe their developmental milestones. If your child is talking when they are meant to talk, or they are actually doing what they are meant to do as far as their development or their age is concerned. The next one is you could actually see a child psychologist to talk to them about behavior of your children and seek early intervention, and always observe your child. How do you treat it? Number one, you can treat it with psychotherapy. And psychotherapy is basically about psychological intervention, maybe with a therapist or a psychiatrist or a behavioral analyst, among others. They will tell you what to do. The next one is medicine. They could refer to you that you should do some medications. And the next one is educational intervention. This is when you talk to the teacher of your children and they have a way to support the children based on the way they design their curriculum or their lesson. What should you do? As parents, always watch out for your kids. Be their friend. Talk to them, observe them, never shut them up because you never can tell what they're thinking. Also, don't abuse the pain of your children because what you are not paying attention to might be what is going to take your child away from you. My name is Hafiz Abdulrazak, and I hope you have learned another thing in this series. The next episode is going to be quite interesting. Thank you and bye for now.